Hi, Joel. So, what are we learning today?
We are learning about respiratory system examination. Tom, first of all, we have to look for the position of trachea. Then we have to look regarding the chest, the shape of the chest, whether there is any drooping of shoulder, any supraclavicular hollowing, infraclavicular hollowing, and then we have to look for the spine.
So, you mean that first we have to learn about the anatomical position of the chest?
Yes, after that, we will learn about the surface, whether there are any abnormalities like any scar, sinus, dilated veins, any visible pulsations. We have to look for apex beat also.
Okay, then after that, what we have to look?
After that, we have to look for the respiratory movements. So this we have to look in all the lung areas. Do you know the lung areas?
Yes, there are 8 lung areas: supraclavicular, infraclavicular, mammary, axillary, infraaxillary, suprascapular, infrascapular, and interscapular. Am I right?
Yes, Tom, you are absolutely right. So that is about inspection. Now we will move on to palpation. So just like in every case, what is the first sentence that we write in the palpation?
That is local rise of temperature and tenderness.
So here first of all we have to write that any local rise of temperature and any bony intercostal tenderness. After that we will look for the anatomy of the chest. So the position of trachea, you have to confirm by palpation. Then the chest circumference, AP diameter, transverse diameter, the chest expansion and the hemithorax. So after that, in palpation we are looking for tactile vocal fremitus. So tactile vocal fremitus we have to look in all the lung areas. So how many lung areas are there?
8 lung areas, as we have said before, isn't it?
Yes, so we are looking tactile vocal fremitus in this 8 lung areas. And as we have said before, we were looking at the surface. So here we have to palpate for the apex beat and we have to localize it. Then next is respiratory movement. So you have to look for the movement of chest, whether it is normal and equal on the both sides. So that is about palpation. So next is percussion. So do you know what will we do in percussion?
Yes, we have to percuss for all the lung areas, isn't it?
Yes, Tom, you're absolutely right. So we have to look for percussion in all lung areas and also we have to look for liver dullness. Next is auscultation. So what are the points we have to write in auscultation? So in auscultation we will look for first of all whether they are bronchial or vesicular breath sounds. Second is the intensity and third is any adventitious sound. Do you know which are the adventitious sound?
Yes, wheeze, crackle, pleural rub, all these are the adventitious sound, isn't it?
Yes, Tom, you are right. And do you know what is the other special thing you have to do in auscultation?
Yes, Jewel, that is vocal resonance in all these lung areas. So once again, let's conclude saying these areas. Which were they? Supraclavicular, infraclavicular, mammary, axillary, infraaxillary, suprascapular, infrascapular, interscapular.
Thank you, Jewel.
Thank you, Tom.